How can we advance healthcare in this time of change? And how can we do things that structurally makes it a better place?
When I think about health equity, it is reaching a place where every single person in our country, and honestly in our world, has the opportunity to achieve their full health potential. And to do that, that means we remove any barriers to full health.
What gets me energized every single day is the mission-driven purpose of this organization. It's really about being able to create a great healthcare experience, not just for a population or for a segment, but really for every single heartbeat in that community.
ESG, or environmental, social, and governance. Those are areas that we at Humana have said we are going to stay committed to. We have to be able to show up in a way that our environment is going to be a reflection of what we want to see inside our walls as well as outside our walls. So take, for example, first, environment.
One of the things that we've been very much focused on is the footprint that we leave on the environment. If you think about the social determinants of health, the environment that folks are in has an impact on their overall health. So for us, we are constantly thinking about how do we reduce our carbon footprint. So for example, we've done a lot of work on reducing the amount of energy consumption that our facilities have to consume. We've also done a lot with regards to waste diversion. When we're doing the demolition and decommissioning of spaces, we divert that waste from a landfill and recycle it. This is just one step in that kind of bigger picture of making sure that the environments of the people that we serve are as healthy as they can be, and we're not contributing to the problem.
The social in ESG really boils down to our ways that we can commit to relationships within the community. So being able to have frontline associates have that relationship with our community partners and address the ways that Humana is thinking more broadly beyond just insurance, but really into the healthcare company we strive to be.
Over the last 18 months, there are a few principles that we really focused on that I think led us through the pandemic in such a wonderful way.
If you have a system where people are disenfranchised and you bring a global pandemic, you will worsen every single thing that they've had. And I don't think that anything about the pandemic surprises people that have understood the challenges that many underserved communities have had for such a long time.
People were being told to stay at home and to socially distance. They needed access to the medication. We were very concerned about the drug supply chain. Can it withstand people stockpiling? Being able to have a strong supply chain was important so that we could be there for our members when they needed those advanced medications in their home.
That's when you saw us focus heavily on telehealth, but it's also where we focused on sending home kits so that people could get testing. And all these things are really how we're going to see healthcare in the future.
When you think about going forward and how our work continues to evolve, there's a lot that we see across the world that's happening, but we also have a lot that we have to work on here within our own country. And we've got structural inequities, historical background in the United States that many other countries don't have.
A holistic approach to our inclusion and diversity efforts really starts at the heart first around belonging, making sure that each person, no matter where they are in the organization, that they're able to bring their full selves to work. Inclusion and diversity are inputs. If we have good inclusion, if we have good diversity, then the outcome is the resulting equity that we see in our communities and how we're able to impact our communities. Those individuals who are able to fully care for themselves and show up fully can then care for our members fully. All of it's connected. All of it is fully connected. We've done great work in the past, but this is also about us being able to say that we have not done enough. We can't just say we're on the right track. We have to have the community also saying we're on the right track. That's how we get to innovation. If you are able to show up fully and I'm able to show up fully and we're able to debate together and come to great outcomes, that benefits our community, that benefits our members. Finally, the G, governance. I love governance more than anything, not because, again, it's always about policy, but to me, it's about having the guardrails, being able to say that as our commitment to our associates as well as to ourselves, what do we stand for? What do we want to stand for? So our governance is going to always be the driver of how we do our work and the importance of what we prioritize, as well as, again, that value add back to our community.
The question was always, how do we service that person, that entity, that thing? How do we keep doctors afloat? How do we help that member who's isolated or lonely? We got to see that come alive. It really harkens back to our investment and our values, but what that unlocked was that freedom to serve.
It was really about how everyone came together, really put the member first, and really focused on what their needs were, and then turned that into action.
So to all of our partners, thank you so much for being there in the most difficult moments that our nation has ever experienced, continuing to stay in the fight and opening our eyes to things that we had not seen or maybe had not been aware of.
There's still more work to do, but I firmly believe we're absolutely on the right path to driving change with individuals, but also in bigger ways.
But really at the heart of that is the human in Humana. So any and all things that we can do to really take ourselves outside of our walls and to really, again, be a good reflection of our communities is where we need to be.